You're watching iWITNESS, the Print's daily live feature covering the coronavirus pandemic. I'm Jyoti Malhotra in Delhi. We have reporters across the country in Uttar Pradesh, in Uttarakhand, and right here in Delhi. I'm joined with Sravasti Dasgupta, who's outside the Guru Tegh Bahadur Hospital, one of the big hospitals in Delhi. Sravasti, thank you for showing us a little bit about where you are right now. So if you could just come a little bit closer to the camera, tell me exactly. It seems to be quite empty, the hospital behind you. Why is that? And what's the situation like in Delhi today?
That's right, Jyoti. As you can see behind me, crowds have really thinned out at major Delhi government hospitals. And this is not just today, and it's not just at the GTB hospital. In fact, we visited a couple of more hospitals, including the Delhi government's nodal COVID facility, which is the Lok Nayak Jayaprakash Narayan Hospital. And there too, we found that crowds had thinned out. Now, what people are telling us is that there are enough beds at this point of time, and they are being able to get more beds because the government has managed to increase the number of oxygen beds by adding COVID care facilities which have oxygen beds. So that has really helped Delhi. We saw a couple of weeks back also people were lining up outside all hospitals in Delhi waiting for beds and trying to get oxygen. But now the situation appears to be a lot better. And the reason it appears is because of these new COVID care facilities which are equipped with oxygen.
So explain to me a little bit more about these COVID care facilities, Sravasti. What are these facilities? How have they added beds suddenly over the last couple of weeks? I mean, Delhi has been pretty bad, and even now mortality rates are still quite high. So what is it that they've done exactly?
So the Delhi government has actually, what it's done is that it has annexed these COVID care facilities to major Delhi government hospitals. Now, this includes the LNJP hospital, which has three new COVID care facilities. One is at Ramlila Maidan, one is at a ground just opposite LNJP, one is at a banquet hall. So these COVID care facilities are one of the ways in which the Delhi government has added capacity. So these beds are around, each facility has between 100 to 500 beds. They are all equipped with oxygen, and people who have moderate illness, not severe illness, not requiring ICU beds, but moderate illness and requiring oxygen support can come to these facilities. And in fact, when we visited these COVID care facilities today, we found that the beds over there were also quite empty. To give you an example, just opposite the LNJP hospital, there's a COVID care facility which has been set up by the Delhi government in association with Doctors for You, which is looking after that. So that's a 100-bed oxygen facility. But today, as of today, only 40 beds were occupied over there. So things appear to be a little more under control here in Delhi. And another important point is that this 500-bed ICU facility has come up attached to the GTB hospital, right opposite the road where we are at this moment. So that has opened just yesterday. So the Delhi government wants that COVID care facility to become an ICU facility to ease the pressure on hospitals. But that has opened just yesterday. So things are just picking up over there. Patients are also few, and the government is hoping that they'll be able to equip that facility so that that can get operational as well.
Right. That seems to be good news, Sravasti. And viewers, I would encourage you to ask questions. Please send them in. And Sravasti is here for the next 20 minutes or so, and she will answer all your questions. Like I said, Sravasti, that's good news that the crowds are thinning in front of these hospitals because of the new facilities that have been added. But I have two questions. The first is that when you went to this Ramlila Maidan facility where you said that less than half the beds were occupied. How many beds are there in the Ramlila Maidan facility, Sravasti?
So the one that we visited, this is just opposite the LNJP hospital. It's called, so it has about 100 beds. And out of the 100 beds, today we found that 40 beds were occupied. Now, all these beds have oxygen facilities, and doctors over there told us that if any patient requires critical care, then they are being transferred to LNJP, which is right opposite that COVID care facility. So now that's how they're managing oxygen care and patients over there. And as patients are coming in, they're finding beds quite easily, even at LNJP, where until a couple of weeks ago, we saw queues of patients coming in private vehicles, ambulances, even auto rickshaws, waiting for a bed, just getting oxygen outside the hospital gates. The situation seemed a lot better today. Even the people that we spoke to outside the hospital said that they were able to get beds quite easily. So it appears that things may be improving bit by bit.
Sure. I mean, I think we're all crossing our fingers because nobody wants to speak too soon. But I have a couple of questions for you, Sravasti. The first is that, does this mean that the hospitals themselves, for example, the LNJP hospital or the Loknayak Jayaprakash Narayan hospital, as it is known, that they are now segregating patients, like what they did in Mumbai with the triage, which is that moderately infected patients are being separated from severely infected patients. How does it work exactly?
So all these hospitals do have triaging facilities. When patients come in, they are triaged depending on. So what the government and doctors at government hospitals are also encouraging Delhiites at this point to stay in home isolation and to observe their oxygen levels. Now, if the oxygen levels dip below 90, that is a cause of concern, and doctors are advising that only then please approach COVID care facilities or hospitals. Now, to ease the burden on the hospitals, these oxygenated beds have been set up as COVID care facilities. Yet, I would like to point out, Jyoti, that there is still a hiccup in terms of ICU bed facilities because under pressure, the government has managed to ramp up facilities at grounds across Delhi and set up these COVID care facilities that we were just talking about. But these COVID care facilities do not have ICU support. So a lot of patients are still running pillar to post looking for ICU beds, which are not available at this point.
So what are they intending to, it's always like, it always seems to us, that the government is sort of a little bit too late all the time. And, we've seen how Delhi has been at the epicenter of this pandemic these last 3 weeks. And, people like you have reported, and several of the reporters at ThePrint have been reporting the story in Delhi. So when they don't have enough ICU beds, and you still hear stories of people not being able to access an ICU bed, then what happens?
That's what, Jyoti. The patients are just left in the lurch, running from one end of the capital to the other. In fact, I met a couple of people today, a couple of people at LNJP, some over here at GTB as well, who said that they had been told that there are beds available at these facilities, but these are not ICU beds, and their family members require ICU beds and ventilators, which are just not available. So what they were saying is that the government has come under pressure and has managed to ramp up facilities in terms of oxygen beds. They've increased oxygen cylinders also, but ventilator support, there's still a shortage of ventilators, there's still a shortage of ICU facilities, which has not been ramped up. And it's not easy also to ramp up ICU facilities in a matter of days. This would require planning. So as you were also mentioning earlier, that things seem to be coming a little too late. So perhaps it is difficult for the Delhi government to suddenly ramp up ICU facilities, but they have ramped up oxygen beds. Now patients are still looking for these ICU facilities and running from all across the capital, in fact.
Sure. Some questions are coming in for you, Sravasti, and a couple of them are related to oxygen supply. And I think if, so somebody called SD, doesn't have a full name, is asking, is there enough oxygen? So perhaps if you can just repeat what you said, which is that there is, some of these beds are oxygen beds, but perhaps there isn't that much ICU beds going around. And there's another question, which is that in these local hospitals, so can you tell us, Sravasti, a little bit about how Delhi works? So, of course, you have the central government-run hospital, which is like the All India Institute of Medical Sciences and Safdarjung. And then you have the Delhi government hospitals, like where you are, which is the GTB or the Guru Tegh Bahadur Hospital. What about the other local hospitals? So, is there sort of like what are the various levels in Delhi in terms of health infrastructure?
To answer the oxygen question first, because that comes from a viewer, I just want to answer that. So the Delhi government has said today that has informed the center, in fact, that Delhi's oxygen needs have come down. Now, earlier there was the Delhi government had said that the need oxygen need in Delhi is over 700 metric tons. Today they are saying that it's just above 500. So whatever additional oxygen had been allotted to Delhi after the back and forth in the courts, the Delhi government has today said that that additional bit, the 200 metric tons or so, can be given to other states who are in need of oxygen. So the Delhi government has been able to do this because they have managed to ramp up oxygen facilities. They have also got additional oxygen support from the central government, which has helped them in putting up these additional oxygenated beds outside of the hospitals and COVID care facilities. Now, coming to the other question, which is about how Delhi works. So, one of the main reasons why Delhi has suffered in this pandemic is because of the multi levels in which Delhi functions. So there is the central government hospitals, which includes the All India Institute of Medical Sciences, AIMS, RML. These are all big hospitals run by the central government. Then we have the Delhi government hospitals like LNJP, GTB, and several others. So there is a sense of among the people in Delhi, there is a sense that they don't know who to ask questions to, because when Delhi government hospitals like LNJP was suffering, were trying to cope with oxygen shortage. These bigger hospitals, central government hospitals, AIMS and RML, did not report such shortages. So there is always a question in Delhi, because it's a city state and because of the back and forth with the central government, that who is to be held accountable, and that also creates a lot of back and forth for the people on the ground over here.
Yeah. Sravasti, another couple of questions on the death rate in Delhi. It's still about 300 plus on a daily basis. Now, you can look at this in two ways. One is that the mortality is coming down, and the other is that there are still 300 people dying in Delhi every day. So can you explain a little bit of what's going on?
While Delhi has reported a dip in cases, in the sense that 3 weeks ago we were seeing close to 30,000 cases, daily cases in Delhi, and as of today, Delhi has recorded 10,000 cases. So there has been a dip in daily cases, but the death rate, as you were also mentioning, has not come down. So now doctors that I spoke to have also said that one of the reasons for this high death rate in the capital is because lot more people are contracting severe illness. It is not like the previous wave where younger people, for instance, would get away with a mild bout of illness and they would get better. Now, doctors are seeing patients of all age groups coming with critical illness in the second wave and approaching hospitals quite late in many cases. Of course, the fact that beds and oxygen beds were not available at all also added to the crisis. And therefore, that has added to the mortality rate, and a lot more people are losing their lives because this second wave, the virus seems to be affecting people more severely, and their oxygen levels are dropping more faster than before, which is reflecting in the death rate. And of course, we cannot ignore the deaths that have been happening because of lack of medical care and attention.
Right. So this question on the mortality rates, there were two people asking this question, Janendra Kumar and Slippery Slytherin, who's obviously a Harry Potter fan. But there is another question by Prabal Sharma Sravasti, who's saying that my relative got this black fungal infection, which is now manifesting itself over the last few days. But the medicine is not available in Bhopal or Madhya Pradesh. Do we know if there are any such cases in Delhi? And what is the severity of this disease? And why is it that the center is not ensuring the availability of medicines for this mucormycosis?
So what we have seen is that in several hospitals in Delhi, in private hospitals, patients have complained about this black fungus that they have developed. So after that, the central government just last week said that there is a need to give fewer steroids to patients. Maybe that may be one of the reasons which is behind this black fungus infection. While patients have raised alarm, the central government, however, has said that this is not a huge concern at this point. It is being noticed in certain patients, and it has in fact been noticed in Delhi as well. But they are saying right now it's a side effect of certain medicines and perhaps steroids may be the reason. But they're saying it's not much of a concern at this point.
I see. Um, Anthony has another question where he's saying that he has heard that certain states have given approval for a drug that, according to the WHO and other regulators, has little or no potency. Anthony, I'd like to respond to your question, and what I would like to say here is that there is so much rumor mongering going on, so much speculation which is not informed. So please don't listen and read, especially messages on WhatsApp. Please be really, really careful about what you're reading and about what you're watching and what you're hearing, because there's so much of misinformation going around that I think. So in this particular case, whether it's WHO that has prescribed a drug, certain states in the country that have ordered the drug directly. I'm not sure what exactly that you're talking about, but all I'm saying to you is that just let's all be very, very careful about the kind of information that we are that we are ingesting. Now, there is another question. In fact, Anthony himself is asking another question about vaccines, and he wants to know whether India is buying vaccines from countries abroad. Sravasti, do you have a view on that? Do you have any information on that?
Yeah, so as we know that the central government has already got Sputnik V vaccines from Russia. That's going to be out soon. And there have been talks about, of course, ramping up production of Covishield and Covaxin as well. Right now, India, at the moment, what is available in India is Covaxin and Covishield, and that is the case in Delhi as well. However, since we are speaking about Delhi, I would just also like to add this about the vaccination problem over here is that while vaccinations had opened for all adults above 18. The Delhi government has raised alarm over that as well, saying that while cases are dipping now, there is a need to vaccinate the entire population very fast. And they are saying that if they have access to vaccines, then they will be able to vaccinate the entire population of Delhi in the next 3 months. However, they have also raised alarm about the shortage of vaccines, and they have said that Covaxin is going to run out in the next couple of days, and Covishield perhaps in the next 10 days. That's what members of the ARC had said yesterday. So the capital is grappling with a vaccine shortage, and several other states have also raised this alarm. In fact, Maharashtra yesterday announced that they have stopped vaccination for those above 18. Now, this is because they want to prioritize the limited vaccines that they have to those above 45 first. And other states have also said this, and states are now actually trying to vaccinate their population, but they're raising this alarm to the center that there is a shortage which needs to be addressed immediately.
Right. Yeah, and just to quickly add to what you just said, Anthony, to answer your question on the vaccines, the Uttar Pradesh government, for example, so what the central government has now done is that it's allocated in the budget itself, 35,000 crore rupees was allocated in the budget for the states to handle this vaccination drive. So now states are directly buying or ordering from foreign manufacturers. For example, Uttar Pradesh has already put out a global tender for 4 crore vaccine doses. I know that Rajasthan, Delhi, Madhya Pradesh, Maharashtra, these states are also in the act of putting together their tenders, and I think the vaccines will probably come in. Hopefully, like you're saying, Sravasti, they should come in sooner than later. DVK Chaitanya, and there's another question from Shatarupa Saha. It's an oxygen question, Sravasti. So she's saying, or Shatarupa is saying that Manish Sisodia, the Deputy Chief Minister of Delhi, has said that oxygen from Delhi will be given away to different states because the demand has dropped. Is that correct?
Yes. So yesterday, Manish Sisodia, in fact, today Manish Sisodia addressed a press conference, and he said that Delhi's oxygen demands are lesser now in comparison to the previous few weeks. So earlier, the Delhi government was asking for about 750 metric tons of oxygen from the central government, but today they have said that demand has gone down to about 550, a little over 500, and they have asked the central government that since Delhi is in a better position now in terms of oxygen, they are in a position to give this excess oxygen, which is about 200, 250 metric tons. They have asked the central government to allocate it to other states which are facing an oxygen crisis. So as things appear right now in Delhi, oxygen beds and oxygen capacity seems to be under control as of now.
Sure. A couple of questions on ivermectin. Sravasti. So one comment which says that people are popping ivermectin and steroids like candies without any prescription. And that, of course, is the worst thing that you can do. And viewers, please be very, very careful. Please do not take any medicines without a prescription from a recognized doctor. Please don't go to your neighborhood quack and tell him to prescribe you something because you have a cough or a cold. You have to take this really seriously. You've seen what's happening around the country. And another question from Sankalp. Sravasti, if you have a comment on this, is ivermectin another fad like hydroxychloroquine?
Actually, as you were saying, Jyoti, that I just wanted to add to that, which will I hope perhaps answer this question as well. Doctors are constantly asking patients to exercise caution and not just pop any pill. So a lot of things are being written about several medicines every day in the newspapers and I mean, not in the newspapers and WhatsApp groups. A lot of things come in the rounds, and people are perhaps not processing information correctly, and there is a need to understand that medicine, this is a very severe disease, and medicines should only be taken as prescribed. Now, the central government as well as the Delhi government have stressed on this again and again, that not to diagnose yourself, not to give yourself medicines, and just wait for the doctor to and listen to the doctor's advice. Whatever the doctor advises, patients should follow the doctor's advice.
Right. And Srinivasan Subramanian has a question about spacing out the vaccine, and I will read out the question. Isn't spacing out vaccine a dangerous exercise? It will mean a large number of semi-immune people wandering about and so pushing the virus to mutate even more. I'm afraid, Srinivasan, that's completely unscientific. And like Sravasti and me have been saying, please don't listen to all kinds of rumors that are flooding the city and flooding all our social media accounts. The fact is that if you have taken one dose, you can wait for at least 7 to 8 weeks to get your second dose. And yes, it is being spaced out because it's giving the antibodies in your body that's coming from the vaccine a chance to kick in and to protect you and to make yourself, to give your body much more immunity than you have right now to the COVID-19 virus. But this point about, semi-immune people wandering about is not scientific at all. So you will get your vaccine. Hopefully, states like Delhi and Uttar Pradesh and these other states are going to get their vaccines from abroad. So I think we should hold on to some of this, some of this speculation. Piyush Chand has a question for you, Sravasti. What is the vaccination rate in India? And there's another question by Abhishek Khandelwal. How long is it going to take for the whole country to be vaccinated?
I think your guess is as good as mine about how long it will take for the whole country to get vaccinated. But let's not forget that the central and the state governments are trying. In fact, the state governments are exerting pressure on the central government to ramp up manufacturing capacity and make vaccines available so that they can distribute it to the people. Right now, it is a very complicated. The central government has now given the states the power to procure vaccines directly from companies, so that vaccines can come faster into the hands of the state governments. And the state governments are doing that, as Jyoti has also mentioned just a few minutes earlier, that several state governments, including UP, Delhi, have already placed global tenders and they are trying to procure vaccines. So state governments as well as the central government are trying to ramp up vaccination capacity, but there is no denying that India is lagging behind in terms of vaccination, and a lot more needs to be done and much faster. This is what experts are also saying constantly, that the vaccination program needs to pick up pace in order for India to arrest the surge in cases that we are seeing right now.
So that everybody can go back to work, at least you're armed with the fact that you have a vaccine in your body and that you can get out into the real world. Of course, I think the real world or the new world will be a very changed world, because even if we have our vaccines, we will all have to mask up and maintain a certain amount of social distance. I think what we did in January, February, March, which is that everybody thought that this virus was over, and we declared the end of the pandemic. The government declared it, the prime minister declared it, the health minister declared it, and so did we all as people. And I think in the new world, even as things get better, the masking will remain, and it will be a very, very important tool for us to continue to combat this infection. So another question about um, who in the central government is responsible for the miscalculation of the vaccine. So I think let me, if I can just quickly answer this, I think that we've all talked about this so much, how the government, the prime minister, the health minister, all of us individuals as well, I think we all declared the end of the pandemic in January when we thought that the first curve had flattened. But like obviously we didn't realize what was going on. And so when the second curve sort of hit us, and we've seen the impact of that. So Mr. Chaitanya wants to know, DVK Chaitanya from you, Sravasti, he sees that the ICMR has issued some guidelines regarding lockdowns when, especially places where the positivity rates are high. Do you have a comment on that?
So the government is, in fact, we have seen right now, if we see that a lot of state governments have already implemented lockdowns, whether it's in Delhi or Bengal or Karnataka, whichever state government has seen that cases are rising beyond a certain point and it is going out of control, they have already imposed lockdowns, even though the central government may not have imposed a national lockdown. Most of India already is under state-imposed lockdowns, localized lockdowns, and state-imposed lockdowns. So what the ICMR is suggesting right now is not very different to what has already been implemented by several state governments across the country. And whether a national lockdown will be imposed or not is a call that the central government will take. But the Prime Minister has stressed again and again that a national lockdown will not be done. So, and he has also stressed on localized containment measures. So that's what we're looking at right now. That state governments are implementing that, and the lockdowns that are being imposed in the states are also not as harsh as the lockdown that we had seen last year, where people lost lives as well as livelihoods. So this time the lockdowns are far more people friendly, but have achieved some sort of success in arresting the cases, whether it's in Delhi. In the past 3 weeks, we have seen cases go down with the lockdown, whether it's in Chhattisgarh or in other cases, lockdowns have been working. Perhaps that is why the ICMR is now suggesting that.
Right. So, in fact, there was another question on lockdown that came much earlier from Ananya Chatterjee. Ananya, I hope Sravasti has answered your question. The question was about imposing a national lockdown and whether it's the best way to deal with COVID. And Sanket Kulkarni, I'm sorry, Sanket, it's taken so long for me to ask your question. His question to you, Sravasti, is what is the positivity rate in Delhi?
So the positivity rate in Delhi has come down drastically in the past 3 weeks, as we were mentioning. Last 3 weeks ago, the positivity rate was above 35%. As of today, that positivity rate is down to 14%. So the Delhi government is saying that while the positivity rate has come down, cases have dipped, which is a cause for cheer, but it is not enough. So they are saying that they want the positivity rate to go down well below 10%, and only then can they think of easing measures a little bit. The lockdown, even though last week we saw cases had gone down, they still extended the lockdown this week as well, because they said that the positivity rate is still high. As of today, even though 10,000 cases have been recorded as opposed to 30,000 3 weeks ago, the positivity rate is above 14%. So there's still cause for concern, and there's no place for complacency, whether it is on the part of the government or whether it is on the part of the citizens.
Right. Prabal Sharma's comment plus question, and he says, the COVID, as we know that the COVID waves will keep coming and that the vaccine doesn't provide permanent protection against COVID. Any idea if things will come back to normal or the next 5 years will be like this? So I think, Prabal, we all need to get used to a new world order when at least for the next couple of years, we will all have to be masked up and be really, really careful about washing our hands, keeping a safe distance. I mean, these sort of basic measures that we must all, must become a part of our daily routine and our daily lives. And I think we cannot, absolutely cannot make the same mistake that we did earlier this year. Piyush Chand has a related question about a third wave, Sravasti, and there's a lot of doom and gloom here, Mr. Chand. I hope we all hope there will be no third or fourth wave, but his question is the government preparing for a third or a fourth wave?
So both the central as well as the state governments have said, for instance, in Delhi, the health minister has said that a third wave will probably come since we have seen several waves in Delhi. In India, we are calling this the second wave, but Delhi has seen a peak in cases several times over the last year. First, it was in June, then we saw a peak in November, and now again in April and May. So Delhi has seen several peaks. So the government here is quite cautious, and they have said that we should prepare for cases to rise again. And as far as the central government is concerned, they have faced a lot of criticism for not being well prepared for the second wave. So the central government is now saying that they will prepare for the third wave. The principal scientific advisor to the central government has also said that it is already time to start preparing for the third wave. So we hope that the lack of preparedness that we saw this time in the second wave across the country, where we saw a huge number of deaths, we are hoping that the government will have learned from this and will already start ramping up capacity for the third wave.
Right. Aarti Dhar's question is, I would like to know the time gap between the first dose and the second dose for Covaxin and Covishield vaccines. Doctors' opinions on this keep changing. And you're absolutely right, Aarti. And one of the reasons that opinions are changing all the time is because the vaccines are simply not available. But the ideal amount of time between the first and the second dose is between 6 to 8 weeks. So you're safe. So don't worry. It's not like you're not going to have a vaccine. I think if you've taken a vaccine now, then you will surely get your second dose very quickly. And even if that goes up to 10 or 12 weeks, it should be fine. So I don't think you should worry too much, especially if you've got a first dose. But that doesn't mean that you should not be careful. Please be very, very careful about getting out and double masking. And that's perhaps the last couple of questions to you, Sravasti. And there was a question about masks, which is that how should you mask up? Should you wear an N95 plus a surgical mask? I know you're wearing an N95. Are you wearing two masks right now?
Yeah, I am wearing two masks because we do visit all these vulnerable places where there's a lot higher chances of contracting the infection, whether it's in hospitals or in crematoria. So that is why we do wear double masks, and double masking has in fact been advocated in the second wave. So the way to go about it is to ensure that your face is complete, your nose and your mouth is completely covered. So what you can do is either you can wear a surgical mask, and over that you can wear a cloth mask so that the fit is snug and there's nothing can come in. The other option is to wear a surgical mask and an N95 mask, as I am wearing now. However, there is a division of opinion on this. For instance, the CDC in the US a couple of days ago said that if you are wearing an N95 mask, it is not necessary for you to wear another mask. But to be cautious, in India, we are going by what our doctors are saying, and we don't know how this virus is mutating. So as of now in India, people are being encouraged to double mask. So whether it's a single surgical mask with an N95 mask or a surgical mask with a cloth mask, double masking is the way to go for now.
Right. Shomik, Samantha has a question where he's saying, what is the UP government's response on floating dead bodies in the Ganga? And these have now come to West Bengal, and the TV channels are full of them. Shomik, I'd like to tell you that just yesterday we had a live discussion exactly on this topic with my colleagues Fatma Khan and Nirmal Poddar. So if you log on to the Print's YouTube channel, and if you just sort of type in the COVID Live, or it's called iWITNESS, our show, a daily evening program. This live program is called iWITNESS. So if you just log on to the Print's YouTube channel, you will find this discussion with Fatima Khan and Nirmal Podar, and I would encourage you to watch that. One absolutely last question, Sravasti. It's a question about the Mumbai, the comparison between Mumbai and how in Mumbai, like Angana Chakrabarti, another colleague of ours who has been in Mumbai these last few weeks, was describing in an earlier COVID live program where she said that Mumbai had been divided into 22 or 23 wards. And it was like a war room that basically segregated patients on the degree of infections that they had. Has Delhi done something like this? And this question is from Debarghya Ghosh.
This is actually very interesting, and we have at the print done a couple of stories on this. In fact, drawing a comparison between how Mumbai has managed its cases and how Delhi has. In fact, my colleague Anisha Bedi has also reported in this, and so has Mansi from Mumbai. So, what we have noticed, as you have just said, is that the BMC war room in Mumbai has been very effective. They have triaging is happening from there. Patients don't need to approach hospitals by themselves. They need to call the BMC war room, the helpline number, and from there, the patient and the families are directed to different hospitals in the city. Now, one of the biggest criticisms that have come in the way of the Delhi government is, in fact, just this, that it has been so long, and Delhi, as I was mentioning earlier, that Delhi has seen several peaks, and over the course of the last year, cases have increased exponentially and then gone down again. Yet there is no designated war room as such, and which has in fact resulted in this mess that we have seen in the past couple of weeks, with patients running pillar to post for oxygen, for beds, for cylinders, all the things that that governments should be equipping people with, and people had to run around for that, and there was no central helpline to call and ask for help. Now, the Delhi government has said that they have the Delhi government website, but I've also done a story on this, on how to call the website, all the numbers mentioned on the website with the hospital beds and the nodal officers. Nobody picks up the phone. If they do, off chance that they do pick up the phone, they say that beds are not available. So this is one area where Delhi has really lagged behind in terms of centralizing the response system in the capital.
Right. Last couple of questions. Abhishek Khandelwal is asking, is the possibility of there being a complete lockdown in the next 3 or 4 days or in the next couple of weeks? Is there a possibility? And I'd like to say, Abhishek just said, Sravasti just said that the government of India, that's the center, has told the states that it is up to them to impose the kind of impose a curfew or a lockdown, but a full lockdown like we had last year in the country is unlikely, very, very unlikely. And Vishwa has a last question, Sravasti, where he's saying, is there a hope for a nasal vaccine and a possible door-to-door vaccine campaign? Do you have any information on that?
So we know that in Maharashtra, for instance, the BMC had offered, had in fact asked for permission from the central government to start door-to-door vaccination, but that permission was not given. In fact, recently, the High Court said that if there was door-to-door vaccination, perhaps the spread of the disease would not have been so widespread, and perhaps the severity of the disease would have been less. As of now, there are no plans of door-to-door vaccination, whether it's in Delhi or in any other city. The central government has not notified any such program. As far as the nasal vaccine is concerned, we know that there are certain companies which are trying to develop such a vaccine, but the Indian government hasn't made any announcements on whether when these vaccines will be available here in India. Right now, we only have 2 vaccines, Covaxin and Covishield, and we are hoping that Sputnik V will be available very soon.
Right, Sravasti, Dasgupta, thank you so much for your time. Please be careful, mask up. I know you're wearing 2 masks, so keep them snugly around your nose and your face. And viewers, thank you for your questions. They've been coming in thick and fast over the last half an hour, and we are grateful for your interest. So please do log on every evening at 5 p.m. and one or another of the Prince reporters is on the ground across the country and waiting to answer your questions. So thank you for all your questions. And Sravasti, thank you for your time. And we will follow you on your journey and your stories over the next few days. I'm Jyoti Malhotra, and you're watching iWITNESS.